What is monkeypox? An infection known as monkeypox is brought on by a virus related to the smallpox virus. Although outbreaks may happen everywhere, several African nations have seen the highest rate of it. Animals and humans may both contract monkeypox. The virus can spread if an infected animal bites or scratches you. Although it's uncertain if dogs and cats may contract the disease, the CDC advises assuming that any animal can contract monkeypox. According to the World Health Organization, WHO, sick persons might potentially expose their pets to monkeypox through petting, cuddling, hugging, kissing, licking, sharing sleeping areas, and sharing food. Avoid contact with animals and pets if you have monkeypox to prevent the disease from spreading to them. Someone else should look after pets until you are fully recovered, if you have any. As we get started, kindly subscribe to our channel Health Guide. Make sure to stay till the end, so you don't miss any important information. What you need to know. 1. Close contact and exposure to respiratory droplets, skin lesions, or other body fluids from an affected individual can transmit monkeypox. 2. Swollen lymph nodes, fever, and a rash that first resembles chickenpox or a sexually transmitted illness, if it appears in the genital or anal area, are among the symptoms of monkeypox. 3. Although the illness has a terrible outcome, it usually goes away on its own. 4. Young children may be more severely affected by monkeypox. Another thing you need to know is that monkeypox can be prevented by vaccine. However, due to the rarity of occurrences outside of outbreaks, broad immunization is unlikely to be required. Finally, according to Hopkins Medicine, although the infection is growing, a pandemic, like the one caused by the COVID-19 coronavirus, is not anticipated because intimate personal contact is necessary for transmission. What causes monkeypox? The virus that causes monkeypox is similar to the one that causes smallpox, although monkeypox sickness is often less severe. Because it was initially discovered in monkeys, it is known as monkeypox. However, rodents, not monkeys, are the virus's main carriers. Because the term monkeypox is misleading, the World Health Organization is renaming the disease. People who have never had the smallpox vaccination may be more susceptible to contracting the illness. What are the symptoms? Numerous symptoms and indicators are associated with monkeypox. While some people only have minor symptoms, others may experience more severe symptoms and require medical attention. Pregnant women, children, and anyone with impaired immune systems are at increased risk for serious illness or complications. Monkeypox is most frequently characterized by fever, headache, muscular pains, back discomfort, lack of energy, and enlarged lymph nodes. A rash that can continue for 2 to 3 weeks develops as a result of or in conjunction with this. The face, palms of the hands, soles of the feet, eyes, mouth, throat, groin, and genital and/or anal parts of the body can all be affected by the rash. According to the World Health Organization, the number of lesions might range between 1 and thousands. Lesions start out flat, fill with fluids, then crust over, dry up, and fall off, revealing a new layer of skin beneath. Symptoms normally last 2 to 3 weeks and disappear on their own or with supportive treatment, such as fever-relieving drugs or painkillers. Until all lesions have crusted over, all scabs have fallen off, and a fresh layer of skin has developed below, a person is still contagious. Anyone experiencing symptoms of monkeypox or who has had contact with someone who has monkeypox should contact or see a healthcare practitioner for help. What can you do to protect yourself and others against monkeypox? By avoiding direct contact with people or animals that may be afflicted with the disease, you can lessen your chance of contracting monkeypox. Frequently clean and disinfect any areas that may have been infected with a virus from an infectious person. Keep yourself aware of the risk of monkeypox in your community and be upfront with anyone you come into close contact with, particularly during sexual activity, about any symptoms you or they may be experiencing. By obtaining medical assistance and keeping to yourself until you have been examined and tested, you may take precautions to protect others if you believe you may have monkeypox. Ask your health professional for guidance on whether you should isolate yourself at home or at a medical institution. Use condoms as a precaution while having sexual contact for 12 weeks, after you have recovered until more is known regarding the transfer of sexually transmitted diseases through sexual fluids. Don't forget to wash your hands thoroughly and often. When caring for someone who has monkeypox or signs of the disease, put on a mask, gloves, or other protective clothing.